All right, what's up, guys? Welcome to my presentation. Today, we're going to be going over plyometrics and how we go about incorporating them throughout the ACL rehab process. So a little bit about me. So my name is Dr. Zack Atwood. I'm located in Metro Detroit area. A couple years ago, I was working for a big health system, primarily working with sports medicine. Always knew that I wanted to do my own thing. And so then I decided to branch off about a year and a half ago and founded my company, Primal Recovery PT and Performance, where we treat primarily anyone from the ages of about 13 all the way to 35, with about 80% of our patients being undergoing ACL surgery. So our objectives today are to define plyometrics and the role that they play in ACL rehab. We're going to break down the different components of plyos. We're going to go through a couple of different systems of how we categorize them, and then we'll discuss some objective criteria when we would initiate plyos in the rehab process, as well as go over progressions, as well as program design across the continuum of rehab. So I don't know about you guys, but this is certainly how I felt coming out of grad school, as well as even in my first few years of practice, to where I didn't know where to start. I think a big part of what I did was I sought out mentorship like you guys are currently doing, and learned from a lot of great people in the field to really kind of improve my understanding of this, as well as getting creative on my own of trying to figure out what works best for certain populations. So I hope that this presentation can provide some clarity, but know that it is not black and white. It is still gray, and we kind of have to try to control some of that chaos. So before we dive into it, I definitely want to give credit where credit is due. A lot of this presentation has been influenced by these three up here. Matt McInnes Watson, who is the founder of Plus Plyos, excellent resource. He really is pioneering this area of the strength and conditioning world, as well as rehab. David Gray is a physio from Ireland, who also incredible resource as far as diving into the plyometrics. And then Derek Garza, who is a physical therapist out in California, who is doing a lot of work with Matt on just kind of pushing the needle forward when it comes to plyometrics and how to incorporate throughout the rehab process. So why plyometrics? Look at it is extremely dynamic and very short ground contact times. Having the ability to improve how we change direction is absolutely critical. And when you look at Kyrie Irving here, much the ability to direct force is what makes him so good at what he does. And then you look at Usain Bolt. I like to look at his head, because as you can see, his head does not drop when his foot hits the ground. So he is so good at creating that stiffness at the moment when he needs to most, by being super efficient with pre-activating his system. And then when he hits the ground, his tendons are so efficient and very reflexive to where he doesn't lose that energy. So one talk that I went to a few years back by Dan Lorenz, I heard him make this comment about, the best athletes in the world are the ones that can put the most force in the ground and do it in the least amount of time possible. And I think that's super important. Getting strong is going to be a big part of the whole rehab process, but we also need to teach these individuals to move quickly, coordination, and efficiency. And that's where plyometrics will really come in. So, Al Vermeil's hierarchy on athletic development, as you can see on the left-hand side, so he was a strength and conditioning coach. They really outlined this nice triangle here. And this is something that I will, on my evaluations, this is something that I write on the whiteboard every single time, just to kind of give the patient an idea of where they're at and what the whole journey really looks like, because there's a lot of buckets that need to be filled throughout the rehab process. And so for today, so Rob Perinello took the Vermeil's hierarchy and kind of made it more specific to the rehab process, where we added in the mobility movement as well as muscle reeducation, but everything else is the same if, again, the goal is to become more athletic and get back to sport. For the purpose of this talk, we're going to be spending most of our time in the elastic reactive strength as well as explosive strength part of the pyramid. And so we want to always ask ourselves, why does this matter? Why is it important? And when we look at injury rates, they're 25 to 30% of, a re-injury, which is just not good. When we look at the injury itself, it takes about less than a tenth of a second for the injury to occur. And that's critical, because if we can improve our ability to react to the ground, that could then reduce the risk of injuries, down the road. So when we increase movement efficiency, we're going to increase our force output, but also our energy conservation. Again, we don't want to be bleeding our energy. On top of that, when we come to the rehab process, a lot of us don't expose individuals to the demands of the sport. And plyometrics are a way that we can really scale them to where they are not only meeting the demands, but also exceeding the demands of their sport, so that we know that we have prepared that individual for what they're going to be exposed to back on the field. And a lot of that comes back to learning. I can't even tell you how important it is to expose the individual early and often. We want to make sure that the individual is not exposed to a triple hop test for the first time on test day at month 6, because we are doing that individual an extreme disservice, because they've never learned. They don't know how to get good at that test if we're trying to have them pass that test. But take the testing out of it. I want to make sure that the individual is moving well. So I'm going to be exposing them to a lot of reps throughout this rehab process so that their body can learn. Because if they start to learn better, their foot contacts are going to be better. Their pre-activation before they even hit the ground is going to improve. All that is good, because, again, it leads to us reducing risks of injury. And again, the ultimate goal with all these things here in the pyramid is to improve the athletic performance of that individual better than what they were prior to the injury. So I'm not going to go ahead and read these. You guys can go ahead and look at those, but I've already touched on a lot of these. So what are plyometrics? So by definition, we need to have that dynamic landing to takeoff based action. So there has to be a prior movement, a prior jump, a hop, a sprint, to where we are coming in contact with the ground and then reacting, and then the whole cycle starts over again. So I have this video here. Show this African tribe here of the dynamic movement and how impressive this really is, of their ability to react to the ground. Very springy. And so when we look at it, the ground contact time to be classified as a true plyometric has to be under 0.25 seconds. And there's some nuance to that. But that's really kind of like the number that we're looking for, to make sure that really that the time is short. But really it comes down to, which I'll get to later, is intent. We want to make sure that it's utilizing that stretch shortening cycle, which includes that eccentric, amortization, concentric phase. So to kind of break that down even more, our eccentric is that lowering, our amortization is that transition from the eccentric to concentric, and then we finish with our concentric, which is our takeoff phase. So going into the intent. So that's really what it boils down to. As you can see here in the video, there's a lot of different levels to this and how we scale it. And progressively going up and up and up with different intensities. And how you coach that is important, because if I'm sharing a patient with another clinician, or I have a virtual client, and they don't know the differences of these different tiers, then that's where things can go very wrong. Because if I have them doing a light tier movement and the individual that they're seeing has them doing a ping tier movement, that is going to be a drastic difference as far as intensity goes. And that can really cause setbacks, flare-ups, and we want to make sure that the language is there. And then on top of that, from the athlete perspective, when you see, especially like the youth, a lot of times they don't give the best effort because they're not used to it yet. This is maybe their first time ever being exposed to any strength and conditioning, and this is the first time they've done anything like this. So again, learning is important, but what I always like to say is make sure you don't dip your toes in the water. So a lot of times youth athletes will start where they're doing this thing where their toes are really just doing all the work, and you never see that foot, the heel drop. And so the intent is kind of weak when it comes to that position. They're just kind of just bouncing around and not really getting that reflex response. We want to see that heel drop so that we know that we're getting that reflex response. So when it comes to coaching it, that's a cue I like to say is like, don't dip your toes in the water. Let's see a full foot contact. And that usually helps clean that up. Now, you don't want to overwhelm them in the beginning, but we want to make sure that they understand the different intensity levels so that they know moving forward what to expect. And I'll walk them through this. I will literally demonstrate what I just showed you in the video just to have them know, okay, these are the differences as far as intensity goes. So when we look at the force velocity curve, again, we're going to be down here in this maximum speed strength area because our force is low. We're not really loading these. We want to make sure that we are focusing on speed. So being very quick off of the ground. And so what's not a plyometric, I made this video. And so a box jump would not be considered a plyometric. Neither would these skater bounds because of there's no dynamic, there's not a dynamic landing to take off. But then on top of that, there's no, or the ground contact time is much longer compared to these where you see the reactivity, again, that dynamic landing takeoff sequence, and we see that stretch shortening cycle being maximized. If I were to go back, you would see, again, I'm starting from the ground and then jumping up. So there's not a prior jump to it. This one, again, just a broad jump. And then here, again, a lot of time on the ground. And so when we dive into a little bit of the history of plyos, it was really Yuri Verkhoshansky was the founding father of the plyometrics and coined this sequence of this training method called the shock method, where the individual drops off of a box, reacts to the ground, and then explodes up. And from that, they found extremely good benefits from this type of training. Here's just an example of one of the Russian athletes dropping off a very high box, as you can see, and then reacting. And so his original breakdown was breaking it into two buckets where you have your intensive versus extensive. And so intensive, as you can see, is the high impact, very neurally demanding. So we're going to do less reps, low volume. And in this case, Verkhoshansky said that this was primarily the vertical movements, vertical displacements. So think of like those drop jumps. Then he classified the extensive as our lower impact, low neural demanding, higher volume. So we can do a lot of reps of these. And those were often more of the locomotive movements, such as like a hopping and bounding type of sequence. Now, where are we in 2024? So Matt McKinnis-Watson has kind of taken this a little bit of a step further. And again, breaking it into the two, you have your maximal intensive versus your submaximal extensive. And again, submaximal is going to be where a lot of that building, that skill acquisition is occurring. Whereas the intensive, that's where you're just focusing on the output. And so when we go beyond just maximal intensity, we have found that the benefits that we get from it is, improving our neuromuscular recruitment, getting a better utilization of our stretch shortening cycle, increasing our pre-activation methods, which again is super critical. If we can anticipate the ground better before we strike it, that's going to lead to, again, a better output, but also our nervous system is already firing before we strike the ground, which can have protective benefits from injuries. And on top of that, sequencing our intermuscular coordination, which is critical, having all parts work together. So think about an ACL injury where if the quad is not up to speed, you're going to notice it, and you're going to really want to work on building that capacity back up so that we don't see those significant differences side to side, because they really do stand out once you get to this plyometric phase. But if we've done a good job of building that quad capacity back up, that helps a ton. But then we also have to integrate it into the whole system. And then lastly, leads to improving our landing mechanics. So the landing sequence itself, here's a video of Matt, and I really love the demonstration of a visual. This helps a lot. So I want you to pay attention to his foot. And so wherever his foot is in the circle, that's the phase that he is in. So we have our 3 flight phases, our 3 landing phases. So right now he is now transitioning into this pre-activation phase here. We'll go ahead and start it. So he's pre-activation, meaning his body is getting ready for the ground. Then we have our electromechanical delay, where once his foot hits the ground, how fast does that signal travel up to the amortization phase, which is now where he's transitioning from that eccentric to the concentric, and then to our rebound phase, where he is in max push, so max propulsion, where he is trying to take off as hard as he possibly can. Then leads to that final momentum where he is just, now gravity is just taking him. He is just swinging through. And back to the beginning, which is our initial momentum phase, which is from the prior jump back into that pre-activation. So when we break those all down, so again, our initial momentum phase is basically from that prior jump, that momentum, to then the pre-activation phase. Now, this pre-activation phase was added on top of Verkoshansky's work, and this is critical because what studies have shown is that the body has, once you get a lot of reps with this stuff, about 40 to 60% of your neuromuscular system is activated prior to you hitting the ground. And that's critical, because if we can get to up to 60% before you even hit the ground, just think again from a injury risk reduction standpoint, that's huge. If we can tense everything before we even strike, that again, that's going to make us more efficient and our output's going to be higher. Electromechanical delay, again, that how that timing from when we hit the ground to then back up to the system, to the amortization, rebound, and then the final momentum. So the tier system by Plus Plyos. So first, I want to really go over the language clarification, because again, when we're in a clinic, when we're dealing with patients who maybe are doing some remote coaching, we need to make sure that everybody's on the same page. And so when we look at leaps, so a leap is a 2-leg takeoff, 2-leg landing. Our hops is a right to a right, so same leg. Our bound is where we go right to left. Hops and bounds are always interchanged. I see this all the time, and that is not good because the stresses that go through the system are significant. So we want to make sure that we are not mixing these two up. A jump is where we go from a 1-leg takeoff to a 2-leg landing. Split stance is now where we're just staggering our feet. Hopscotch and gallops I don't really use a ton. I know a lot of people in the track and field world do a lot of gallops to like work on rhythm and stuff. So when we look at the different tiers, we have our deep tier, light tier, which are our lower intensities, and then our medium tier, which is going to be more of our sub-max, and then our ping tier, which is going to be our maximal intensity. And so one that I did not talk about so far is the deep tier. So the deep tier is technically not a true plyometric, just because we are the ground contact time is much larger. So we are moving through deeper range of motion, trying to really promote more joint stability, Really great for building tendon health, ligament health, joint health overall, as well as teaching the body to absorb, to yield, which is critical, especially in the post-op ACL. So as you can see here on the right-hand side, as we go up to ping tier, our intensity increases, which means our volume is going to be lower. Light tier and deep tier are stuff that I'll talk about later as far as like introduction to these types of movements. Whereas medium tier is where I usually will say that's from a criteria standpoint, that's where the true plyometric criteria is where I will initiate those more of those movements because they, again, the intensity is going up. Ping tier is where we're just giving all out effort, focuses on max output. And so when we look at just movement variability and variety of directions, as we go from the deep tier to the ping tier, we want it to be more simple. We don't want complexity when we are trying to generate max output. It's the same thing as if you're trying to generate maximal squat, output. I don't want to have that person standing on a Bosu ball. Why? Because that's complex. It's the same thing here. So as we're getting into more of the ping tier, it's going to be more in a linear fashion, very simple movements. We're not trying to do all this crazy type of stuff. When we get more down into the deep and light tier, that's where you can get really creative and build that individual's movement capacity, their tissue tolerance, and play around with different directions to really challenge them and then further on enhance their motor learning by exposing them to a lot of different positions. As far as our overview of movement progressions, we're going to want to progress from a double leg to then a split stance to a bounding. So again, going from right to left or vice versa, to then our hopping, which is going to be our highest intensity, where we're going single to single. And then direction, always will start in place with people just to get them used to the movement and then start to progress them towards our linear. So starting with forward, then backwards, then incorporating multi-directional, medial, lateral, and then rotational. One thing that I will note here is when I've had people, especially after a surgery, transition from in place to forward or backwards, one coaching cue or one thing to look out for is their lean. So a lot of times in place is a really nice way to start because the only thing that they can do is just go straight up. As you start adding forward backward movement, a lot of times people will just use momentum and they'll do this like kind of lean thing and be like quick off their feet, and they're not getting that nice up and down reactive movement that we're looking for. They're just kind of like tilting forward and almost falling forward. So that's something to really look out for when you're transitioning from in place to linear. But if you've built up a good capacity, you've educated them on what you're looking for while they're in place, that tends to help as far as cleaning up the forward and backward. So another system that I wanted to discuss is the exo system, which everything very similar in the sense of the movement and direction. The one thing that they touch on that we haven't really talked about yet is this initiation. And so as you can see here, though, movement's the same: leap, jump, bound, hop, direction, and then we'll talk more about the different components of these initiations. So going down the list, we're going to progress in intensity. So our non-counter movement and our counter movement, again, those are not typically, those are not classified as a true plyometric because, again, there's no dynamic landing takeoff, and also the ground contact time is much longer. I'll have videos of all of these as well to follow, just to kind of really help explain, because some of the verbiage is a little bit confusing. Then we have our double contact, which the video will be better to explain that. Our continuous, where we're just linking multiple reps together. And then our depth and our drop jumps, which are going to be the most intense, which we already talked about a little bit with Verkoshansky's work and the shock method. So non-counter movement here, you're having the individual go down, they're going to pause. So you're taking away the eccentric as well as the amortization phase. So for somebody who maybe from a coordination perspective struggles with that transition, this might be a really good start for them where you're just taking that out and you're just having them start there. Then from there, we'll go to in a full counter movement where we're now sequencing the whole eccentric, amortization, and concentric, which will lead into a lot of our testing for return to sport. Double contact, the individual is going to pick up, strike the ground quickly, so utilizing that stretch short of the cycle here better in slow-mo to then propel themselves further. So again, using that tendon reflex, they're going to try to propel themselves a little bit more than what they would be able to without using that. And then continuous, again, we're just linking multiple repetitions together. You could do side to side, linear, again, getting creative with it. And then our depth jump. So in this case, you can see here, I'll pause the video when we get to the side angle. One thing that I would say that I used to get confused with is depth versus drop jump. So I like to think depth is in deep. So I'm really loading. So as you can see here, when I pause the video, I am quite low to the ground. My goal is to jump as high as I possibly can. And that is exactly how I cue it, because it's going to be cued differently if I'm focusing on the drop jump. So for here, I say try to jump as high as you possibly can. So the individual is going to really load and explode. When we get into the drop jump, now the box here, this would not be appropriate for like the shock method, because the shock method, the box has to be a certain height for it to really give that stimulus that we're looking for. But in the rehab setting, when an individual is coming back from an injury, we may want to start at a lower box, as well as just from like a fear perspective. If they're standing up on a 30-inch box, they're going to be staring at the ground, and they're going to be not feeling super confident that they can react. But drop jump is where my cueing now is try to jump as high as you possibly can, but spend the least amount of time on the ground. So we're really emphasizing that ground contact time. So you'll see here when I pause the video, the difference in my loading phase. So there you can notice, my hips were down here before, and now way, way higher up, because now the goal again is to be quicker off the ground. So biggest question, obviously, when it comes to incorporating all of this in rehab is, where do we start? So Buckthorpe et al. Came out with a paper a few years back for incorporating criteria for plyometrics in the ACL rehab process. And then as you can see here, we want pretty much very minimal pain, hopefully none, but very minimal. Full range of motion, that's a non-negotiable. Knee flexion at this point hopefully would be more than 120. Definitely no to trace swelling. Again, we don't want to add extra impact on a knee joint that already can't tolerate loads, and it's still demonstrating swelling. So I want to make sure that that's good. Why? Because that's going to inhibit the quad. Okay, so we want to make sure that we're not just constantly affecting that. Squat wise, obviously, if you have force plates, that would be the most ideal to look at, asymmetries. If not, obviously it's not the best, but the eye test, just to see is the individual, shifting side to side. Now, Graham et al., Megan Graham came out with a paper a year ago, I believe, looking at power development and jump performance and how it relates to quadricep strength, especially knee extension torque. And what she found was that when individuals were above 2.07 Newton meters per kilogram, they demonstrated better jump performance, more symmetry, opposed to those who were below this number. So for her, it was a good indicator. And 2.07 is roughly just above 70% of the individual's ability to push their body weight. So for math purposes, simple math, if I'm, let's say, 100 pounds and I pushed 70 pounds on the knee extension isometric test, that would put me probably around this value here. And so that's an important thing because we want to make sure that they have the capacity to take on this external load. So when we talk about plyos, I want to make sure we, especially from the rehab space, we really dive into getting the individual prepared for that. So what I call the pre-plyometric prep phase. And so there are a few ways that I really like to look at this part in the rehab process. And the first one being, I like to think about the different phases that make up the movement. So we have, again, our eccentric, our amortization, and our concentric. So we can really break these down and build the capacity and then integrate them to work on all of it. And that seems to work quite well. Another thing we can do is we can manipulate the individual's body weight, having them start supine, which I'll have some videos of some examples, and then work their way up into standing to where they're working at least on improving their striking, their foot contact. You can also use, as you transition to standing, you can use bands to help unweight them. We'll dive into some of that later. And then the last thing would be we can manipulate the ground contact time. So making the movements more extensive, more yielding, and really working on building tissue capacity, more of like those deeper tier types of movements. So when we look at the different phases, so for the eccentric phase, here are some examples of what we can do as far as, why did that not save? Okay. So when we look at the different phases, for the eccentric phase, we can do things like heavy eccentric loads with our exercises. So we're really working on building that capacity, building the breaks. You can do snap downs, some step and holds, altitude drops where we're dropping off from a box and sticking, deep tier movements. And then another big component that I really like to incorporate is yielding isometrics, where it is more eccentric dominant, where you're putting a person into a certain position and having them hold it with not letting gravity take over or any external load. Very great for building a lot of strength in these positions, especially like more run specific positions, which I'll show you later. Then we have our amortization, where we are looking at things that we can incorporate like pulses. So at the bottom of a goblet squat, adding a little pulse into it if we're having difficulty with the transition part. Again, deep tier is going to be the bread and butter here. Oscillatory isometrics, where we are working on rapid contraction and relaxation. So again, that transition piece, which have been very, I have some examples there that are things that I like to do as well that just help with improving that integration piece. For the concentric phase, we're looking more at our, non-counter movement jumps. So taking out all of the other phases, things such as overcoming squats. So if you were to, load up the bar and put the rack at a certain height, and then you have that individual just, stand up from that position. So you're starting from like a dead stop. Then you have things like accommodating resistance, where you can add bands and chains so that when they're at the bottom position coming up, that's where it's going to be the most difficult. Seated box jumps, broad jumps, again, taking out that momentum. And then things like overcoming isometrics, where the individual is pushing into something that is just not able to move. So you're activating high neuromuscular recruitment and focusing on like rate of force development, which is huge for, again, this part of the rehab process. So for the continuum, here's just a list of the different exercises and things that I like to go through as far as the pre-plyometric continuum. And then the orange is more of our true plyos. I'll have videos of these so you guys can just reference back to this, but we'll go through some video examples here next. And then same thing, I added in this is a newer thing I added in, is the run specific isos, the yielding isos, which I already kind of touched on. some ISO switches, and then oscillatory ISOs, which again, I already kind of talked about, but I'll show you guys some video examples of these. These I will say anecdotally have been a game changer for incorporating in this process, because we need to be able to yield, we need to be able to overcome, and we need to be able to do that transition piece. And when you can get an individual into specific positions, such as a running position, whether it's standing or supine, and you're able to actually generate the same amount of force that is going to occur when their foot hits the ground, build a resilience there, build their ability to generate that force and hold or push, we're getting that neuromuscular recruitment, and we're training that body to be resilient in that specific spot. So super great tools here that Alex and Atera has been really a pioneer for. So we'll dive into some videos there. So starting off, so some sleds. Really like to start with sled work very early in the rehab process, just to make the individual feel like an athlete, right? But we can do this for range of motion stuff. So if I'm working on active extension, but when we're getting into this more of this phase where I'm trying to really strike the ground, it's just a very lower impact type of movement, but we're still getting, putting our foot in, sticking it into the ground pretty abruptly. And then you can add in some multi-directional, doing some lateral work as well. This is a drill that I really like to do with a lot of people, especially young kids who just don't have the motor coordination yet. A lot of times individuals will fight themselves. So, when they're going down, their arms are going up. And then when they jump up, their arms are going back. So they're basically fighting their momentum. And so this is something that you can give them just to do at home, and just to practice the sequence for when we are looking at things like our counter movement jumps. Snap down variation, so showing just a split stance and then a single leg. And so here, again, ways that we can progress it is just adding more load is one way. So obviously these are the more advanced ones that you can also start double leg and then progress to split and then single. So adding like a medicine ball, if you wanted to focus on like single leg stability and not necessarily the eccentric rate or force development aspect, you could throw in like a water tube to really challenge more of that dynamic stability. And then step and sticks. So biggest thing, we want to make sure that the individual, again, can yield, they can absorb. A lot of times after this ACL, process, they will be very stiff. A cue that I really like to say is like, don't hit your head on the ceiling, which is going to then cue them to try to stay low. I really, really shift away from using cues, like more internal ones with this type of stuff. Like, hey, bend your knee more, because they may be able to do that right after you tell them that. But then down the road, that's not going to improve motor learning long term compared to using more of like an external focus, external cue. Something that you could also do is put like a laser on their forehead and then have them try to stay below a certain level, whether you put tape on the wall or something, just to try to help enhance that external feedback opposed to the internal. So freeze frame running, basically just integrating the step and holds. I like to do this also to like a metronome, where I have them just do it kind of in place, not necessarily going forward, and actually having them sink down even lower, and then just having them do like a metronome to like 180 beats per minute, to where it's like they're basically simulating running, but they have to maintain that triple flexion. And I actually promote even more to exaggerate it, because what you will see is the individual, especially on their involved side, their head is going to bob up when they are trying to do it on their involved side, which is just showing us that they don't want to be in those deeper ranges of knee flexion. So going off of the supine standing progressions, this is a really nice David Gray, starting with just our regular here on the left. They're going to bridge up, their butt is not on the ground, and then to strike the wall really nice way to get the individual to start working on first striking the ground, making sure their knee can tolerate it, getting the intermuscular coordination between the ankle and the hip, as well as their foot contact. And then lastly, the pre-activation phase. So as they're striking, they're working on striking, their muscles are going to get engaged before they even hit the wall. And then here's just another progression off of that to where you can do like an up and down. And then this one is a more advanced where we're trying to do a quick reaction off the ground while maintaining that hip up and then back onto the wall. Really love using these in the earlier phase, as we're getting prepped for things like running and stuff and plyos. And then I'm not going to bore you with this video, but going through our skipping series, so our A skips, our B skips, our C skips, and more of this is just again more for rhythm. Again, making the athlete feel like an athlete again, and just kind of after this injury, they're going to feel awkward. So just getting that rhythm back can really help them, as well as just getting their timing down, their foot striking, and all that good stuff. And then getting into using a ladder here. So can do some stepping patterns, hopping patterns. Again, this stuff's not going to make you a better athlete per se, but again, just going back to rhythm and reintroducing it. The nice thing about the ladder though is it gives the individual an external focus. So if they're struggling with certain things just out in the open, sometimes giving them targets can really help with that. So our run specific ISOs. So here I have an individual post-op ACL. At this point, I think he was at about 8 weeks. And I have him doing a knee ISO. So he's pushing up into the rack where the rack is really fixated. His knee is about like 30 degrees of knee flexion. So something very similar to, again, our running position where they're going to be. And they're just trying to, I say, try to lift the rack. Push as hard as you possibly can. In this case, was more of a rate of force development focus. So, our time is going to be much less. So we're looking at maybe 2 to 5 seconds of generating that force. Whereas if I'm looking more for longer holds or maybe trying to work on improving inhibition, I might have them hold it for 30, 45 seconds. If they have a tendon issue, again, 30, 45 seconds, maybe up to 60. It just depends on, again, what is your focus. Here's a video of a hip iso push. So the individual heel up, back on the another box, and they're driving their hip up into, again, an immovable weight. So one thing that you can do here is if you do have access to like force plates, you can track. There's actually a setting on the Vald force plates where you can track this and see, what it is that they're able to generate. And now they have started to come out with some norms of numbers to look at as far as where an individual should be when we're talking about initiating running again. And then some yielding ISOs. So have an individual here, he just lifts up the bar a little bit, and then he's just holding this position. So really working on building the capacity, not letting the weight win. And that is going to be a more of an eccentric focus, for the mechanism. Same thing here, all the hamstring, similar to a hip iso push, putting the weight directly over the hip. Drop. Now, one thing that I will say that I was very guilty of in the beginning when I first started diving into these types of movements is underdosing like crazy. So honestly, sometimes you just got to pick a weight and just see how they do on the first one. If your goal is, 20 seconds for strength, and you throw a weight on them and they hold it for a minute and a half, then you need to go up. Like I want to make sure that they are struggling for those 20 seconds. And so trying to play around with that, but that was a big eye opener of how much I was underdosing those, just because I saw people, struggling and didn't really challenge them. So I've gotten people up to holding a barbell with 135 pounds on it and trying to hold that for 20 seconds, whereas before I was throwing just 15-pound dumbbell. So definitely push the athletes, even though they're just isometrics. Oscillatory, so more of focusing on that amortization phase. So again, adding those pulses. Here's a really nice option from a split squat position. That transition, I really want to see those hips moving up and down, and they're not just staying stiff. So I like to see the ankle, or I like to see the knee pump, the femur pump, to make sure that we're really loading that leg. Here's another single leg hamstring bridge I've really liked to do, again from David Gray here. So holding that bridge and then quick pulses. So we're getting that dynamic movement, that rapid contraction relaxation right here at the hamstring. Another nice option there. And then here we have an iso switch. So again, once the individual has built a lot of tolerance, maybe a few weeks of doing the iso or the yielding holds, maybe you can then progress to something like this where they are doing now a switch. So they have to rapidly change and create force quickly so that their hips don't drop. So you can see here, very impactful bench. And you can see the hips are not dropping. He's doing a very good job of maintaining that hip height. Again, probably an 80-pound dumbbell on his hips. Another really nice option to incorporate. Again, working on that pre-activation, pre-tension, as well as intermuscular coordination here with a lot of these ISOs. So let's dive into some programming design. So here is pretty much everything we just went over from a video perspective. Just following the arrow up, as we get up here, more of our aggressive types of movements. But this is our pre-plyometric phase. So starting from the less stress and then just kind of working our way up. And when I say the light tier, deep tier, those are going to be now when we're starting to incorporate more of our quicker ground contacts with the light tier. Deep tier is more challenging from a neuromuscular standpoint because we're working through larger ranges of motion. And at this phase, this is going to be more difficult because people struggle. They may look totally fine with their light tier movements because light tier is going to be more of the tendon, more reflexive. When you're challenging them in the deep tier, you're challenging more of the muscle. And that is going to be very difficult, especially when people don't have their full capacity back yet. And then from a just overall overview of our, rehab progression to return to play, we have here our light tiers, our foundation, the deep tier, and the medium tier are really the meat and potatoes of it. And then transitioning up into our ping tier. Now, one thing I also want to touch upon is, so we have, leaps and bounds and hops down here. But down here, I want you to know that this is referring to more of like our lighter tier. Whereas we have bounding again up here, our hopping up here, but this is going to be more towards our ping tier. Something to also note, though, is whether we are going for another way we can increase intensity or focus is if we're going for distance or if we're going for height. So when we're talking about the quads and knowing what muscle group is affected, following ACL reconstruction, vertical is going to be much more difficult for the individual coming back from ACL reconstruction. Horizontal, just like their hop test, they tend to pass their hop test before they pass their single leg vertical jump. And so just keep that in mind, that they may be okay for the most part when you're doing stuff for distance, more horizontal movements. But then when you challenge them with a drop jump, a tuck jump, a vertical jump, a hop for height, a bound for height, that's where you will probably see the most difference. but also just lets you know that that's where you need to spend a lot of your time to help regain that capacity. So diving into more definition of the light tier. So this is a really great start point for plyometrics, and again, you can start this relatively early. Again, before those criteria, I'm usually introducing light tier because I want to make sure we're introducing it. It's safe. Monitor their swelling, monitor their stiffness, monitor the range of motion. But again, this is very rudimentary compared to the medium tier and the ping tier, as well as running. It's very less, compared to those. So we can start here and really build the individual's volume. We're going to have relative joint stiffness, higher volumes of landings, short ground contact. So just think about like being quick off the ground, but again, not being toey. Don't dip the toes in the water. Then we have, so here's just an example of light tier. Again, quick off the ground, not leaving the ground a ton. And we can spend a lot of time, building that phase up. Just another example of just adding in a split exchange. Again, this one, now we're starting to introduce more load going through that leg that is coming through. So a nice way to progress to a single leg or a bound as the individual is gaining more confidence, capacity. Biggest thing to look out for here is obviously knee flexion angles, making sure that the individual is not just being stiff on the one side, making sure they're not just tilting their weight forward and using momentum, and making sure we see that nice reactive response. You can even watch their head just to see if it changes height, to give you an idea if they're underloading one side. More of our medium tier, so we're going to spend the majority of our time in this phase. Still not maximal. We still have that the relax moment of the plyometric. We're going to cover longer distances, build a lot of volume here. Again, it's still more extensive in nature. We're not going completely all out. So I always like to say, with this, I like to show them medium tier and ping tier, the difference, and then just basically say, I want you to give me more effort than our light tier, but I don't want this to be an all out effort to where you're just gassed after a few reps. So here's an example of our medium tier. So you can see here, for a single leg hop, as I get into the air, my body is still relatively relaxed. My arms aren't doing a ton. Like usually when you see the ping tier, you just see everything is just engaged, everything's involved. Here you still see that moment of relaxation when I'm in the air. Some crossover bounds. So again, definitely not a maximal intense effort. Body is still relatively relaxed as I'm coming up off of the ground. This would be a great introduction for anybody, that's involved in change direction sports. Lastly, we got our ping tier. So again, maximal intensity, fast ground contact, maximal joint stiffness, and we're going to be doing much lower volume, much lower distances. So here I've got the front squat doc. Really, really, just everything is just involved. You can see his arms just punching to the sky, trying to get maximal height with these split exchange leaps here. And then here's more of a ping tier for hop that I'm doing. And you can see my arm is really punching more through compared to the last rep. And I'm really trying to get that leg up as high as I possibly can. This would be an example of me doing a hop for height. So definitely gonna be a lot more quad focused opposed to me going for more distance. And then last one we have is the deep tier. So again, not true plyometric, but really, really great for supporting all the other ones. And again, in the rehab process, you see people struggle big time here. People need to spend more time here because we spend so much time in our sports, which are more of those reactive light tier, medium tier, ping tiers. types of stresses that we don't spend enough time building this up. And so this is a really important phase here. So again, joint range of motion is going to be much larger, absorbing more, longer ground contact times, very metabolically demanding for the muscle. So like I said, this is going to tax the muscle a lot and not so much the tendons like the other ones. And we're going to be able to do more volume to really help build that up. And then we can break it down even further to yielding or overcoming. And so when we talk about yielding, I always say I just want you to be sinky. So really working on just that absorption, staying low. Again, deeper range. Whereas the overcoming is where we're working still through large range of motion, but they are trying to explode out of that bottom position and then coming back in. So that's why we have higher eccentric stress, just because we are going out hard and then we are absorbing that as well into that deeper range. So I have a couple of videos here just to kind of outline the difference. So here would be more of our yielding. So the individual is just focusing on staying low. Again, I want to see is his femur pumping, so you can see the hip dropping, getting that nice bob there, which is good, getting that muscle just to cook. Whereas our overcoming would be like this, where the individual again is getting low, but he's trying to explode out of that bottom position, working on more of that concentric power development. So when we look at program considerations, what we've already talked about, right? So intensity has to be inverse to our complexity. So as we get more intense with our movements, we want to make sure that that becomes more simplistic, because we want to make sure that we are focusing on the output and we don't just want to make it all crazy and random for this individual. We want to focus on being very simple with our movement if the intensity is high. As we get to those lower levels, we can get more creative with our types of movements to expose the individual to multiple stresses. And so here's an example of just a patient post-op ACL of something that I would do. Now, this is not post-op week 1, week 2. This would be more of when we're starting to introduce things like this. So, again, let's say if things are going well, I'll use an example of a current patient. He's currently at 13 weeks. We probably started doing this at week 9. So he's starting to introduce, his light tier types of movements, leaps, split stance, in place and forward. Our volume is starting off 80 to 100, and then we are just building week by week. As we progress, week 4, maybe we start incorporating more of the deep tier, because again, that's going to be a lot more challenging for that individual to yield. And then maybe we start incorporating some multi-direction just to, again, challenge the system. And then as we progress to weeks 5, 6, now we're starting to introduce some of the unilateral movements. So maybe some hops and bounds. So at this point, he would be at week 13, week 14, which is really where we're at right now, introducing this stuff. Still light tier, deep tier. The bilateral movements, we're doing all directions. And then unilateral, we're doing just sticking with the light tier for now. Again, our volume is building. Week 7, 8, we're doing all stances for our bilateral movements, and our unilateral is the same as well. Now we're starting to introduce more multi-direction for our unilateral work, as well as our deep tier type of work. And our volume is now getting much higher. 9 and 10, now we're starting to incorporate more of our medium tier. And from here on out, so now he would be about week 17, week 18. This is where from now and moving forward, we're going to be really maximizing this medium tier and maybe using a light tier as more of a warm up. And so our unilateral, direction wise, we are, multi-direction for the light tier stuff. And then for the deep and light tier, deep and medium tier, we're going to start with primarily just linear, and then the following weeks we'll progress into multi-directional. But you can see here the contacts are 300 plus, and 300 plus may sound like a lot, but when you actually add it up, it's really not, because if we say, 10 yards is one set, and you're doing, uh, 2 to 3 sets of that with that specific movement, that right there is already about, 30 to 50 contacts, and you multiply that by doing like 3 to 5 movements, you're already up in that, 300 plus range. But again, that's not something where you would start somebody right away. But the goal again is now we can start shifting towards more intensity. So now this volume is going to start to dip. So now I have just an example of a session, day 1 and day 2. So that's usually what I'll do especially at this point in time where, we're working on, strength, 2 to 3 times a week. We'll incorporate some plyo days, whether they're on our strength days or on off days. But I like to break it up at this point into one day being more volume intensive versus one day being more intensity focused. And how I will structure that will for sure. I like to, at least the way I like to structure it is putting the more intensity sessions at the beginning of the week, and then letting the volume be more at the end of the week, so that they have some extra rest, as well as I want them to be fresh coming into the week with more of the intense session. So I would just flip these here, day 1, day 2. But as you can see here, high volume day, we're hitting 370, which is a good amount here. Our light tier, we're doing 3 rounds by 10 yards, right? Not a ton. We're doing forward, we're doing backwards, we're doing medial lateral. We're doing single leg bounds. We're doing single leg hops to a bounding pattern. When we do bounds, I'll count those as 2 contacts. So that's why you see here it's double. And then we get into more of our medium tier. So we'll use this as like a primer. So our light tier is more of our primer. Medium tier is where, again, we're looking for those adaptations, that neuromuscular learning, all of that good stuff. Deep tier is used more of like that burnout. So again, I don't need to have my fresh energy at this point. And so I'm just focused on muscle capacity, aerobic capacity, and just building this deep ranges of motion, and control. Whereas then when we go into our day where it's more intense, less volume, you can see very quick in this first light tier phase where we're just doing, 1 round, 10 yards, and then spending majority of our time in this medium tier. And then again, finishing off still with some burnout sets, but definitely less compared to the day before. And so that's kind of how I like to structure my sessions, in addition to their strength stuff that they're doing. So when we look at volume, frequency, intensity, we kind of already talked about this, but again, beginner would be a good place to start. 80 to 150 contacts a week, which again is not a ton when we're breaking it up during the week. But again, error on the side of caution. Look at your soreness rules, your stiffness, your range of motion, and make a good decision. Don't be dumb. Don't leave your patient, sore for 4 days after doing these. You don't want to crush them with this. And then as you get into more advanced, we can get into that 300 plus, 2 to 3 sessions a week. Primarily I'm going to do 2, throughout the rehab process, split between, 48 hours in between. And again, our sets and our reps, I usually go yardage, just to keep it simple. 2 to 3 rounds of certain things. And then depending on how many exercises that I'll do, I can build from there. But this is just a really nice overview to kind of reference. So from there, I will leave it at that. If you guys have any questions, please don't be afraid to reach out. I highly encourage them. This is stuff that I am extremely passionate about, still learning myself to just constantly get better at. But if I can help in any possible way, please reach out. So I appreciate you guys tuning in, and I hope you guys have a great rest of your day.